Good afternoon. I'm Dana Dooley, and today we're going to talk about emergency housing technicians. Emergency housing technicians is actually something that we're going to be going over that regards 24-hour case management services. Imagine Friday afternoon, 4:57. This is actually me. Believe it or not, 4th of July weekend, that was a Wednesday this year. I was on my way out the door, 4:57, and there was a young lady named Markeisha. I thought about not answering that phone call. I thought about reserving my time. I thought about actually adding to my caseload or not adding to my caseload. But the more and more I thought about it, I said, who else was here to help her? Markeisha was a young lady who was previously on my caseload with rapid rehousing. Rapid rehousing, if you do remember, is for persons who are waiting for their Section 8 voucher. Markeisha, as we call her, got her Section 8 voucher more than a year ago. However, on July the 3rd, she called stating that she was in danger of losing that voucher. Unfortunately, Ms. Markeisha is one of many persons who need additional services, especially case management services, in order to keep that housing voucher. So today we're going to talk about the grand challenge of ending homelessness by taking a proactive, not a reactive approach. Homelessness is one of those multifaceted situations. We know there's numerous reasons why persons end up homeless. In Markeisha's case, she actually was a person who had an adoptive family who just so happened to pass away. Markeisha has 3 kids. There was no other way that someone here was to support her in another way. So, for this case, she was actually calling to see if we could assist, or if I could assist, with getting her utilities together. Together really means, can you help me pay my utilities so I'll be able to keep my housing voucher in the unit that I chose? Therefore, I started thinking about tenants, landlords, the community, and all the needs that they may have. Some of those needs may include, I need a housing search because I just got this housing voucher. You only get 30 days to seek housing if you do get a Section 8 voucher. Who's there to help you with that? There's no case manager assigned to a housing agent that distributes those vouchers. Also started thinking about utility coordination. You can only accept a Section 8 voucher if your utilities are paid in your name and up to date, ready for any kind of activation. Third thing, community referrals and service coordination. What if you had your furniture in storage? Who's there to help you with that? Community referrals going along with that. A lot of times, in order to even get to your new unit, you need a lot of other things in place. What am I going to sleep on? What am I going to eat on? Some of those things that make us even human. And the last 2 things, advocacy. Advocacy, there's a lot of persons, especially with those norms, the cultural norms of, I don't want that in my neighborhood, or these persons of, not in my backyard. In addition to that, last thing, every year, paperwork needs to be recertified to remain with a Section 8 voucher. Recertification paperwork is very cumbersome. It can be very difficult for someone at our level of education to understand. Nonetheless, Markeisha with at least a 10th grade education. What happens at 6 p.m.? Remember, it's the holiday weekend. I'm still working with Miss Markeisha at this point in time. Our wicked problem is that most agencies do not stay open past 5 o'clock. After the sun goes down, often housing stability problems begin. And that's where the problems really begin in our communities. Where do persons go for any kind of assistance? I'm sorry, unfortunately, Ghostbusters does not come out till next summer. Who are you going to call? There's no 24-hour case management in place for these persons who are supposed to be stably housed. We get them housed from rapid rehousing, got your voucher, we give them that proverbial golden ticket, you're supposed to run off into the sunset. No problems from there on out. But that's not the case. 10 o'clock. I'm still concerned about Markeisha. I've left the office at this point in time. However, I'm trying to send any email I can on that Wednesday because I know offices will not be open until that Monday. It's the 4th of July holiday. Markeisha, I know for a fact, is nervous. She was crying on the phone. I thought to myself, who else could help me with this situation? In addition to my ongoing caseload of at least 62, I have to devote at least another 2 to 5 hours just to assist someone who has been closed out and someone who needs additional assistance. Markeisha is going to end up back into the shelter. It is not very fair, or it's not very affordable to have this happening on a regular basis. At this point in time, or currently, I am actually having at least 2 to 5 calls a week from persons who have previously been housed through rapid rehousing. These particular families or individuals, also some veterans, they have gotten their Section 8 voucher and they're returning to us within 18 months to 24 months after obtaining that voucher. That is a problem. So, some of the comparative analysis that we're talking about is really about data tracking. I'm tracking everything by hand at this point. Unfortunately, HMIS, the Homeless Management Information System, they don't track this data. They don't track how much recidivism is back into the shelters. They're not tracking within the City of Detroit continuum of care how many persons who are families, how many persons are pregnant, how many persons are veterans that are returning back to shelters. And they're not also tracking appropriately this point in time count. Point in time count, or the PIT count, actually has been stating this proverbial 550,000 persons on a given night, once a year, are homeless. However, every outlet that we've been stating and reading about and just kind of taking in is stating that these are very estimated numbers. They have no idea of how many families are couch surfing. They have no idea how many families and individuals who are living in a house or a place that's uninhabitable. Here in Detroit, we have a lot of squatters. We have the housing stock. So unfortunately, these persons aren't being counted. So we have some skewing of the numbers, and that's something that we need to work with. Comparative analysis also lets us know that there are 28,000 vouchers being sent out to the communities within the state of Michigan. The website says 28,000 vouchers. However, it does not tell us when they're dispersed. Is this 28,000 every 2 weeks? Is this 28,000 once a year? Is this 28,000 over 5 years? So we have to work on some of our data that we do have in the media at this point in time. What's going on now to really compare this analysis is permanent supportive housing. Permanent supportive housing, PSH that we call it, is actually for persons who have a disability and have the chronicity of homelessness status. These persons throughout PSH, they're persons that get the housing subsidy and the case management subsidy that is coupled together. SAMHSA, the Substance Abuse Mental Health Association, has provided an evidence-based toolkit. This EBT evidence-based toolkit shows that the fidelity scales, persons are staying housed longer with a case manager in place. A case manager are one of those persons that we were talking about that can handle all those other things. Our fidelity scale through PSH is also showing us some of those numbers in which persons are able to get employment and training. They're able to even get all types of community resources together to feel more of a neighborhood, to get that sense of, guess what, maybe it is my backyard. 7:30 a.m. 4th of July, 7:30. I'm still thinking about Markeisha. I said to myself, I sure wish there was a way I could get paid for this. Life is what it is. I'm a lowly social worker. My time is important as well. So I started thinking about, how about an emergency housing technician? I should be functioning, and I am kind of functioning, as a paramedic, a first responder, a person that someone can call at any point in time if you have a housing crisis. If I broke my leg today, I would call 911. I would expect someone to pick up that call because I need their help. to be dispatched to my home. Why is that different for someone in a housing crisis? These emergency housing technicians should be home-based. This will keep our costs down. They could be on call just as child protective services or foster care workers. An EHT can also, they should probably be in teams of 2, dispatched to the community. EHT, just as a paramedic's not functioning as the doctor. We're functioning as the triage to get to where you need to be. That broken leg, the paramedics are not fixing that. They're not setting it. They're not doing the therapy on it. They're not giving me the medication. They're stabilizing the situation until it's transferred to someone who's more suitable. And that's exactly what we're talking about with this proposed intervention. We're really just stabilizing till it's a more suitable situation. 3 a.m. Just for an example. Who are you going to call if you do have a housing situation? We're thinking at this point in time to have a tiered level crisis management for our prototype. If it's 3 a.m. and it's a domestic violence situation, will the EHT go out? Probably not so much. If it's a landlord that's having an issue with the tenant and they have a case manager, oh yes, definitely. Why wouldn't we have that relationship be symbiotic between that tenant, landlord, or otherwise to keep that person housed? Oftentimes, if it's 3 a.m., someone has a house fire, I do not know that this person has had a fire. I don't know that they've been displaced until 9 o'clock the next morning or 9 o'clock the next business day. And that's not fair to our families. That's not fair or affordable to our communities as well. Budget, resources, sustainability. Just letting you know, permanent supportive housing is billable in 15-minute increments through our insurance, especially Medicaid. Permanent supportive housing has already told us the fidelity scale from the evidence-based practice that this is a suitable and effective technique. Why wouldn't we transfer what's already existed to this innovation? Persons with Section 8 vouchers need assistance too. 15-minute increments. Markeisha told me on that telephone that she was transferred at least 4 to 5 times. If she was able to be billed for through Medicaid, I bet you she wouldn't have been transferred not one time. Contractual staffing. Remember I told you they're going to be home-based earlier? They need to be contractual as well. This can be something that would really be flexible for 2 supervisors to be on staff, 5 paid staff that I was thinking about, intern opportunity, flexibility. These are things that us lowly social workers would not mind going the extra mile, especially if it's worth our extra mile. 2:30 a.m. for an example. What are some of those challenges? We have a lot of unintended consequences in this life. I wish I knew what I don't know. There's a lot of things that we're going to be continuing to track. Acquiring data from that HMIS data set, especially for those agents that are supplying the vouchers. How many of those families are returning back? I will actually have to go ahead and reach out to those housing agents who disperse those vouchers to get a list of those persons so we can keep track of them. We have a transient population that we're dealing with here, so data tracking is very important. Staffing in the community. I don't care if it's 2:30 a.m. or 2:30 p.m. It is very difficult to go into the community with human beings. It's human nature. It just is what it is. I'm also concerned for our potential challenges of having an overflow of family and friends. You've helped me, I want you to help someone else. We're going to make sure that there's barriers in place to make sure we're helping the persons that it's intended to help. So, social impact and innovation. There's a lot of impacts with this. We're talking about, we're preventing that recidivism back into shelters. We're freeing up family space. We are reducing child protective services. We are increasing the long-term housing community. We're increasing the sense of community, so there's not so much in and out of neighborhoods. Benchmarks. We're trying to implement this within the fall of 2020. We're going to be following up quarterly after persons receive that voucher, a pre and post test. In addition to that, more surveys are going to be needed in interviewing. Merging of all the data from all the parties. That means the City of Detroit, the continuum of the care, and the housing agents. We all need to be on the same page. So, what do I need to do next? Networking is my number one thing that I need to do. Networking with all those parties that are in power, especially participating in the monthly COC meetings. These are meetings in which executive directors are invited to. However, the community is invited to as well. This is one thing that Ms. Dana needs to do. Last few things that I do need to do, I'm going to meet with the Director of HAND specifically, and I'm going to have to obtain some access from the Detroit Housing Commission, who is also a separate entity that has Section 8 vouchers. Lastly, I need to allow for some networking at the state level, that Michigan Housing Development Authority, the persons who dole out that money from HUD. Outside of that, Markeisha was able to get what she needed because I was available at that point in time. It would have been much more suitable for her to have someone who had the ability to take care of their family and to make sure that their family was stabilized. What would happen to Markeisha if I wasn't there? What would happen to Markeisha if we didn't have an EHT? What's happening to all the other Markeishas in her family at this point in time? So I hope that this sheds a little bit of light on why we do need emergency housing technicians.